Hello guys, good afternoon. Welcome back to my YouTube channel. This is Miss Henderson. It has been a while, but I'm finally back here to do a few CNA test questions for you guys. So guys, as always, if you like these types of videos and these types of content, please consider subscribing to my YouTube channel and please like and share. And you can also find me on TikTok, Prometric at 2024 and CNA.test. So here is our first question we have here that states, the nurse delegates a task to the NA. The NA is the nursing assistants. Which of the following involves the communication steps? Think about this question. The first choice we have here is the nurse observes the care you give. B, the nurse explains the task. C, the nurse thanks you for the task. And D, the nurse assesses the person's need. What do you think might be the correct answer for question 1? Remember, it's only an RN or a licensed practical nurse can delegate a task to you as a CNA. A CNA cannot delegate. We spoke about this one in the classroom. And we said the CNA cannot delegate. So what do you think might be the correct answer for this question? The correct answer for this question will be the nurse observes the care you give. Why does the nurse have to observe the care that you give? The nurse must observe the care you give because she is accountable and responsible for your work. You're working under her license, so she has to ensure that you are competent to perform the task. Okay, let's look at another question. Question number 2. You have been delegated several tasks. What should the NA nursing assistant do? A, refuse the task. B, ask the RN to help you prioritize the task. C, delegate the task to another CNA. Well, we just said that CNA cannot delegate, so it wouldn't be delegate the task to another CNA because CNAs are working under the directions of an RN or LPN. So do the easiest task first. So what do you think the correct answer might be for this question? Take a moment and think about it. The correct answer for this question is to ask the RN to help you prioritize the task. That's the correct answer. B will be the correct answer. Question number 3, which of the following tasks can be delegated to you? Administer medications, insert IV catheters, reposition a patient Q2 hours, supervise other CNAs. So take a moment and think about this question. It's not a difficult question. I'll give you a couple minutes or so to come up with the correct answer. So guys, that moment is up and the correct answer will be reposition a patient Q2 hours. That is within the scope of a nursing assistant. As a nursing assistant, you do not administer medications, you do not insert IV catheters, you do not supervise other CNAs. You can reposition a patient every 2 hours to prevent pressure injuries, and that is definitely within the scope of practice for a nursing assistant. Let's look at another question. Question 4. The nurse delegates a task and watches you complete the task. Why do you think the nurse is observing you? Why do you think the nurse is observing you? A, the nurse does not trust you. Oh, I don't think it should be A. A is not the answer. B, the nurse is accountable to make sure you are competent. C, the nurse is testing your abilities. D, the nurse should observe every task you do. So guys, take a moment and think about this answer. It's not a difficult question, but take some moment and think about it. It's not a hard question. So the moment is up, and the correct answer is the nurse is accountable to make sure you are competent. You are working under her license, therefore you have to she has to ensure that you're doing the task correctly. So it will be B is the correct answer for question 4. Let's look at question number 5. The nurse provide corrective feedback on a task you did well. Which response is appropriate? These questions are not hard, guys. They are simple nursing assistant test questions. They're not difficult at all. So why you think that would be the correct? You're doing a task and the nurse is observing you doing the task, and she's providing constructive feedback or providing corrective feedback on the task. Why is she doing that? It's not a hard question, guy. Take a moment and think about it. You can do this. Why is she providing feedback? And how do you respond? Tell the nurse you are too busy, argue that you were not taught the correct way, suggest ways to improve on the task, defend your education. What do you think is the answer? Definitely not A, definitely not B, and not D. The only one that makes any sense there will be C. It will be B. Will be C actually. Suggest ways to improve on the task. So when your nurse educator is talking to you about a task that you didn't perform so well, you don't get combative, you don't get agitated, you can suggest ways to improve on the task. That's the only thing you can do, because arguing about it is not going to help anyone, and being nasty about it is not going to help anyone. So you need to like accept constructive feedback, and be able to work with your nurse educator. Okay, so guys, I think those are the questions I have for these sessions. They're just a few slides. Again, if you like content like these, please consider like, share, and drop a comment below, and subscribe to my YouTube channel. You can find more questions on my TikTok page. I already told you my TikTok page, so thanks for watching. Bye for now.